Hi there, I'm Dr. Michael Ye from UCLA Health Endocrine Surgery, and today I want to talk about the BRAF mutation in thyroid cancer, including what it is, what it means, and how it can affect treatment and outcomes. What is the BRAF mutation? When we talk about the BRAF mutation in thyroid cancer, we usually mean the BRAF V600E mutation. BRAF is a gene that normally helps control how cells grow. But when this gene is changed or mutated, it can tell cells to grow too much and too fast. It can also make cancer cells spread into nearby tissues. In short, the BRAF V600E mutation sends growth signals that cause a cell to grow out of control. There are two main types of mutations in cancer. First, somatic mutations, which are changes that are acquired, that happen during a person's life. And germline mutations are ones that are present in every cell in our body and are inherited from parents. The BRAF V600E mutation is a somatic mutation. That means it's only present in the cancer cells and it's not found in every cell in your body. You didn't inherit it from your parents and you can't pass it on to your children. This kind of mutation usually happens as our cells age and repair themselves. It's part of how some cancers start, but doesn't change your whole genetic makeup. Now, how common is the BRAF mutation in thyroid cancer? The BRAF V600E mutation is found in several different types of cancers, such as skin cancer, melanoma, colorectal cancer, and even lung cancers. In thyroid cancer, about 40% of all thyroid cancers have it, and about 50% of papillary thyroid cancers have it. Please remember that papillary thyroid cancer is the most common type of thyroid cancer, making up more than 90% of new thyroid cancer diagnoses every year in the United States. A question we get all the time is, does having the BRAF V600E mutation mean that I'm going to have a worse outcome? And this is where it gets interesting and complex. About 10 years ago, doctors thought that having the BRAF V600E mutation meant a higher risk of the cancer coming back or being more deadly, but now we know more. Now, most people with papillary thyroid cancer do very well because these cancers are small, slow-growing, and rarely life-threatening in most cases. Since half of papillary thyroid cancers harbor the BRAF mutation, but 95% of these patients do great, then the mutation alone isn't the full story when it comes to outcomes, right? What does recent research show? Well, over time, we've learned that context matters. For example, older patients, ages 55 and up, who have the BRAF V600E mutation may have a slightly higher risk of having an aggressive form of thyroid cancer than younger patients. Men who have the BRAF mutation may also have a slightly worse outcome than those without it. This tells us that the BRAF mutation doesn't work alone. Other genes and other factors also play a role. Today, we understand that having the BRAF V600E mutation in isolation, all by itself, is usually not a major concern. But if it occurs together with other mutations, such as TERT or P53, the combination can signal a more aggressive cancer. We sometimes call these double hits or late hit mutations. The good news here is that these combinations are rare, occurring in only 5% of thyroid cancers. Now, what if you have the BRAF mutation? If your biopsy or surgery pathology report shows that you have a BRAF V600E mutation, don't panic. It doesn't mean you have a dangerous or untreatable cancer. Most patients with this mutation end up living completely normal, long, healthy lives. And even in rare cases where the cancer acts more aggressively, we now have targeted therapies made to block the BRAF mutation. These exciting new treatments are showing promising results for the small number of patients who need them. If you have more questions about the BRAF mutation or thyroid cancer, please talk to a thyroid cancer specialist. Once again, I'm Dr. Michael Ye from UCLA Health Endocrine Surgery, and thank you for watching.